I'll hear about it. Good afternoon. Today is July 27th, 2017, and this is the Washoe County District Board of Health meeting. The first item of business is roll call and determination of a quorum. Madam Secretary?
Yes, Madam Chair. Kitty Jung,
Present.
Dr. Novak,
Present.
Oscar Delgado.
Here.
Dr. Hess is absent. Christopher Dare.
Present.
Michael Brown is absent, and Tom Young is absent, and we have a quorum.
All right, thank you very much.
Thank you.
Considering that tomorrow is Councilman Dare's birthday, I think we will give him the honor to lead us in the Pledge of Allegiance.
Would you please join me? I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Councilman, and happy early birthday. You're welcome. Madam Clerk, do we have public comment?
Not at this time, Madam Chair.
Thank you very much. Item number 4, approval of our agenda for today, July 27th, 2017.
I move that we accept the agenda. Second.
I have a motion by Novak, second by Delgado. Any further discussion?
Madam Chair, may I interrupt?
Yes, can you use your microphone, ma'am? Because we are on TV.
Yes, ma'am. There was a request to speak that was placed on the counter that I did not see until just this moment.
Okay, so we do have a public comment.
Yes, we do.
All right. Would please call that public comment. She wants me to call. Okay, we have general public comment on item number 3, and that is Miss Kathy Brandhorst.
Oh, is this working?
Yeah, you can put it up. Thank you very much.
My name is Kathy Brandhorst, and I'm also the United States President. I just wanted to tell you there has been a lot of difficulty where I live. When I moved in, there were all seniors living in those apartments. Now we're down to 3 seniors. And it's not fair that these people that don't have a place to live have to murder them and then take over their home. All their belongings, everything was still inside the apartments. And they just moved themselves in, and they use their things. They wear their clothes, whatever else that they had, inside their home, they are using. And these people were chopped up with the electric chainsaw next door to me. And we're still going on. It's still going on next door to me. It's more murders because they do hang them by the neck and then they chop their heads. And the MRIs are still on my property inside my home in the living room, and they still murder all the U.S. military through those MRIs. And I was told that they would be destroyed, but they have not been destroyed at all. The MRIs are still there. And I just wanted to let you know the electric chainsaw has been chopping up people. There's a big scene right now. I don't know if you can see that or not, but that's how they leave the human bodies. And we've already had another 150 dead. Oh, excuse me, 210 now. And you people know that the population has been going down because we do not carry guns. We don't have a way to protect ourselves either. They are the ones on death row that carry the guns. They have the ammunition to put inside the rifles, inside the shotguns, handguns stolen from police, sheriffs, and wherever else they can get these guns from. Bows and arrows are also used, as you can see that.
Thank you very much, Ms. Brandhorst. Is there any additional public comment, Madam Clerk?
No, there is not, Madam Chair.
Thank you. Item 5, Mr. District Health Officer, please take it away.
Thank you, Madam Chair. Thank you, Madam Chair. Is this working now? Okay. Next, we have recognitions, and we have several new hires that we would like to introduce today. And I would like to start with Victoria Stebbins, a new Office Assistant 2 in our Vital Records program. And if I could have Victoria stand, and perhaps Dr. Todd, could you come down and do an introduction of, bring Victoria down and do an introduction for her for the board?
Madam Chair?
Yes,
I
ma'am.
hate to interrupt, but
No.
evidently the item number 4 was not approved.
Oh, we didn't approve it?
Oh,
Sorry, hang on just a second. Victoria, usually this is a much more smoother operation. It's a weird day. We had a motion by Novak, a second by Delgado. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thank you, Madam Clerk.
Thank you.
Dr. Todd.
Good afternoon, Madam Chair and members of the board. I am pleased to introduce Victoria Stebbins. She is a relatively new Office Assistant 3 assigned to work in our Office of Vital Records. And she comes to us from the Department of Ag at the state. And so we were pleased to have her come over to the good side of government. And she's been doing a great job down there. I continue to hear wonderful things about the progress she's making. It's a bit more complicated than most people think. And, but I'm hearing wonderful things about the progress that she's making as a new employee there.
Wonderful. Welcome aboard. Don't go anywhere because we're going to do photographs, okay? Thank you. Thank you.
and my apologies, I didn't have my cheaters on, so that's Office Assistant 3. And next we have Biddy Mendoza. She's Office Assistant 2 in immunizations. And Mr. Cutts, if you could have Biddy come up with you and make an introduction.
She's cute.
Good afternoon, Madam Chair, members of the Board of Health. I'd like to introduce Brianna Mendoza. She goes by Beatty. She is our new Office Assistant 2 in the immunization program, and she comes to us from Renown Health, where she previously worked as a hospitalist coordinator and inpatient financial assistance. So we're excited about her experience that she brings to this position with insurance eligibility verification, and we're excited to have her in our immunization program.
We sure are. Welcome aboard, Biddy, and also stick around. You will also be a victim of our photography.
And I'll just stay here.
Yes, Mr. Cutts, if you can stay there. We have
Vanessa Ramirez.
Ramirez, Office Assistant 2 in the clinic in CCHS.
So I'd like to introduce Vanessa Ramirez. She is a new Office Assistant 2 in our central clinical area of CCHS. She previously worked for A&B Precision Metals for 6 years as a production control assistant, and she started there at an entry-level position and worked her way up to front office for the company. She's also volunteered for Planned Parenthood and did outreach programs there for 5 years. And she's always ready to learn and pass on information to others. She's been, both young ladies have been a great fit in our clerical areas, and we're excited to have Vanessa as well.
Welcome aboard, Vanessa, and it sounds like this job is going to be a lot more exciting. Thank you. All right, Mr. Kevin Dick.
Next, we have some reclasses. Lori Mendoza, who's not able to be here today, has been reclassed from an air quality specialist to a senior air quality specialist based on the increasing responsibilities that she's taken on. We have Will Lumpkin. Also, I don't believe Will was able to make it today.
He's spraying for
One of
mosquitoes.
our excellent vector-borne disease specialists that's being reclassed to an environmental health specialist. So, of course, they're busy. This is a reclass that, while they'll still remain working in our vector-borne disease program, will provide them with additional flexibility to be able to provide support in other areas of EHS as well. We do have here with us today Jeff Jepson. Jeff, if I could have you stand up to be recognized, and then we'll do a picture, so stick around. But Jeff also is being reclassified from a vector-borne disease specialist to environmental health specialist, and so thanks for making the effort to get over here today, Jeff.
Thank you, Jeff. Congratulations.
And then also, we have William Mountjoy, who, Will, if you could stand up to be recognized, impeccable timing, who is going from an environmental health specialist trainee 1 to an environmental health specialist trainee. And basically what we've done is reworked our classifications a little bit, so we will no longer have a trainee 1 and 2, but it'll be a continuing within that class. So thank you and congratulations,
Congrats.
Will. And then next we have years of service. And so I'd like to start with Lenny Shore, public health nurse in our immunization program. Lenny, if you could stand up in the back with 15 years of service to the health district, and I don't know anybody as passionate and committed to immunizations as Lenny is. So congratulations, and again, stick around. We'll take some pictures, and I've got a certificate for you. Daniel Timmons, air quality specialist, has got 5 years of service. Daniel's not able to be here today because he's busy running ozone standard down to Sacramento for calibration. So making sure that our data is good that we're collecting from the program. And but we do have also, with 5 years of service, Brendan Schneider, air quality specialist, and Brendan does a fantastic job for us with our monitoring and planning program. A lot of the alerts that you'll get from AirNow are thanks to the work that Brendan's done to help get that system all set up.
Terrific. Congratulations. So I believe we should head on down and start going through our new hires, reclasses, and years of service. And I do have a ID. So individually, the new hires. Here's the center.
You do. Right at the center.
On three, please. 1, 2, 3, and one more. 1, 2, 3. Great.
Many, many years.
Thank you.
Okay.
Thank you.
Congrats.
You're welcome aboard.
Thanks for joining us. New blood, especially Latino blood. I love it.
On three. 1, 2, 3, and one more. 1, 2, 3.
I don't know about that. We talk later.
3, 1, 2, 3. 1, 2, 3. These guys are big fly swatters.
Thanks for listening. I really appreciate it.
That's about the budget we have.
On three. 1, 2,
We've met just like recently. Did he just do a picture with us? You are. I guess they like you here. As long as you like it, it's not important. You're good.
On three. One, two, three. And one more. One, two, three. Good.
Thank you. Congrats. Thanks for showing up.
We should have done Lena first because she needs to go back and
Oh,
give shots to the
sorry.
kids for, got the schools,
Oh,
immunization
schools,
stuff going on.
right.
Oh, yeah. Congratulations, Lenny. One, two, three. And one more. One, two, three.
Thank you so much for your service.
Thank you. See,
Brendan actually started as an intern.
Wow,
Lost him for a
terrific.
couple of years and got him back.
Wonderful.
You need to make sure you like your quality Facebook page, because then. Oh, good.
I will.
On three. One, two, three. And one more. One, two, three.
Congrats. Is that it?
And then we have years of, I blew it. I didn't pull out the certificates.
But you know what, you can just.
I'll make sure we get it to them. Yep.
Thanks, Oliveri. Who left this open? Okay. Who left this open? Or my brother's kids. No.
I mean, I wasn't gonna point it out. It's okay.
Maybe I did.
anyone under?
Thank you. Well, congratulations again to our new hires, our reclasses, and the years of service that our employees so selflessly dedicate to public service. To me, the highest calling that you can do, so thank you. Item 6 is consent, and I do have public comment, and I just wanted to point something out for the board in case you didn't recognize, but item 6C, which is we're looking at our financial review for the end of the year, and it turns out we're $7,000 in the black, which is
$700,000.
$700,000 in the black, which is a banner day for the Board of Health. So, and that says a lot to the management of Mr. Kevin Dick, the district health officer, because none of you have been here as long as I have, and was always a nail biter at the end of the closeout. So, and Miss Heenan as well. It's her steady hand at the budget. So it's really good news and speaks very highly of your administrative ability,
And if I
Mr.
could
Kevin Dick.
add,
Yeah.
well, certainly I couldn't have done this without Anna Heenan. But also, we're not yet to the final month 13 figures, and I'm expecting we have an even better number
All right.
to bring forward. So.
Next month then, right?
Pretty happy with what we had.
I know. Okay, I have public comment before we take a vote, or if you want to pull anything out, let me know as well. This is for item 6B, which is the budget amendments and interlocal agreements. Just 6B it says here, and that's Miss Kathy Brandhorst. And Madam, this has to do with public and behavioral health. So if you could, for Community and Clinical Health Services Division Fetal Infant Mortality Review Program. So if you would please address that issue.
Yes, I will.
Thank you.
My name is Kathy Brandhorst, and I'm also the United States President. Clinical Health Services Division Fetal Infant Officer to execute the subgrant award. Well, I don't really understand what you're trying to say here, but I am very concerned about stealing insurance. Stealing insurance to have a baby born or a baby delivered from somebody else's body and then charge my insurance to that person who had a baby. that is stealing my insurance. That insurance does not have your name on it. It doesn't belong to you, so I don't know why you have to deliver a baby. Also, when you say fetal infant, I've also seen the little 4.5-year-old boy splattered all over the place. I didn't even know I was walking on human organs. I did not know that I had blood underneath my shoes. But when I scraped my feet on the sidewalk, the blood was running down the sidewalk off my shoes. So I just wanted to let you know, the fetal infant is very crucial right now, because when you kill and murder a little tiny boy of 4.5 years old, and you splatter him all over, there's not very much left of this little boy at all. And he said he was in prostitution. He said he hated it, but you had to hold a gun against his head to continue to prostitute. Yes, this little boy cries day and night. He's homeless. He's thrown out of his home. He walks the streets in the middle of the night, homeless, crying. He doesn't know where to go. He doesn't know where to live. He can't even remember his own name. This is really awful, to hear, but this is the truth. And you people don't have it in your heart to help this little boy? I saw him yesterday. He looked like a very old man. He couldn't even move. He couldn't even move his arms, his legs, or his head because it was
Thank you, Ms. Brandhorst. All right, let's bring it back to the board. Does anybody want to pull something out of consent, or I would entertain a motion?
I move to approve the consent items.
I have a motion by Dare, a second by Novak. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 7 is our Regional Emergency Medical Services Authority update by J.W. Hodge and Dean Dow. I do want to mention Chairman Begley is here in the audience and will be coming back next month to address us, as well as Board Member Louis Test from REMSA. So I appreciate both of your attendance here today, and the District Health Officer owes you lunch. Okay? Thank you. 2 lunches, okay. Thank you. Mr. Dow, you
Good
have the floor.
afternoon, Madam Chair, members of the board. I'm Dean Dow, President and CEO of REMSA and CareFlight. Know that all of you have your copy of the June compliance report for our organization, and I'm available for any questions if you have any.
Does anybody have any questions from the report that Mr. Dow has submitted? No? Okay. This is an action item, and therefore I do have public comment for item 7A that we have to take before we accept your report. And 7A, Ms. Brandhorst, is the review and acceptance of the REMSA operations report for the month of June of 2017. Ms. Brandhorst?
Again, my name is Kathy Brandhorst, and I'm also the United States President. I just wanted to let you know the REMSA operations report. Well, I do help out every once in a while when I'm on the streets. I do see a REMSA truck parked, and I will assist them. I will tell them exactly what's been going on in the area, how they got chopped up with a butcher knife. Oh my God. Well, I'll tell you, the REMSA just, kinds of looks at them. But they have to call in the, fire truck. Oh my God. Then they have to call in the police. I agree with the police department and the fire. department too. Because why didn't the REMSA sew him up, put him to sleep, take him to the hospital, make sure he had something to eat, something to drink? Because how long has he been laying in that bed or laying outside? You know how long? Maybe a month. Because before anybody finds a dead body. I just wanted to tell you, you know, the REMSA's report, what is their operation? What is their proof that they can put a body back together? I never see this. I always hear them saying, well, I got to send it to Renown. I've got to send it to maybe St. Mary's Hospital. And you know what? I did not hear them arrive at either hospital with the dead body. Are they really putting these bodies back together inside the REMSA trucks? They do have insurance. They work. They are U.S. born. The insurance is to help cover their, like being murdered to death, stabbed to death, bullet holes to death. You know, I know that these people do have insurance because they work every day of their lives. They do get a payroll check. I know that too. And I know they have very good insurance. Why would you have to do that to a person who has insurance? If they didn't have insurance, what are you going to do? Throw them in the gutter and say, I don't take care of people who don't have insurance?
Thank you, Ms.
Brandhorst, your time is
Brandhorst.
up.
REMSA services everybody, whether they have insurance or not, and additionally, you don't have to be American-born to partake of their services. So thank you. I will entertain a motion to accept the operations report.
So moved.
Second.
I have a motion by Novak, second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. Dow, the item 7B is an update on your public relations during June 2017.
Mr. Burton will be here.
Okay.
Let me introduce him to give you the highlights. Thank you.
Good afternoon, Madam Chair,
Can you pull your microphone
members of the
up?
board.
Excuse me, can you pull your microphone up
I'm
and
sorry.
state your name for the record?
My name is Paul Burton, Director of Operations for REMSA.
Great.
I'd like to take just a moment here to highlight some of the work it's been done in the community with the last week or last month and ongoing. June 9th, we assembled the state mobile hospital in order to retrofit certain pieces of it. For those that aren't aware of it, the hospital, it's a state mobile hospital that is housed at REMSA. It's got 12 pods, allows for up to 300 patients. It's state-owned. We maintain it and also use it as we need. As part of that, we have a contract to be able to set up this mobile hospital at any point, anywhere in the state. This new retrofit was on a state subgrant, which allowed us to deploy and set it up a little bit faster, which was pretty successful. June 16th to the 25th, we provided medical coverage for the Reno Rodeo in conjunction with the Reno Rodeo Association and Justin Sports Medicine. We're currently working with Aaron Keniston and Richard Walsh of Gerlach to provide mutual aid coverage during the population increase for the Burning Man event from August 26th through September 9th. And lastly, we're finishing up instant action plans and upstaffing for the several Hot August Nights venues that are coming up here within the next week. Do you have any questions for me?
Can you explain what, I didn't understand the state hospital. Where is it?
So the state
Is it a mobile?
It's a mobile tent
Okay.
system. It's 12 pods that we maintain at REMSA and can use throughout the state as we need.
Okay.
So,
That's great. I didn't know about that. Dr. Novak,
Following up
Mr.
on that-
Vice Chair.
Thank you. Following up on that same thing, with these mobile pods, do you ever deploy them to some of the large wildfires?
since we've had it, we have not. but we have used it for other large-scale events. We use it for the air races, typically for a mobile clinic for that large scale, and some of the other events locally. We haven't been actually called by the state to set it up at this point. So.
Okay, just curious.
Sure.
It's a nice asset.
Yeah.
Yes, it is.
Any other questions?
Any other questions? No? Thank you very
Thank you.
much. This is not an action item, so we will move on to item 8. Presentation on completion of Panther Drive septic to sewer conversion project to address public health threat posed by perched groundwater and failed septic systems. And Dwayne Smith, you are gracing us with your presence today at the Board of Health.
Good afternoon, Madam Chair, Board. For the record, Dwayne Smith, Director of Engineering with the Community Services Department. So thanks for giving me a few minutes to come and give you an update on this very successful project. Project was a success because it really required a lot of coordination between internal departments, other jurisdictions in the state, and ultimately all with the focus on public health. So as you might recall, back in the spring of 16, area residents notified the board, the health department, that there was possibly some smells and other things associated with the roadside ditches along Panther Drive. So, of course, accordingly, the health department sent out their teams. They did some investigation work, and yes, they did determine that there was untreated wastewater in the roadside ditches, Washoe County's roadside ditches. So immediately they took the action of posting advisories, sending out information to the residents, making sure that they weren't coming in contact with that water. At the same time, they reached out to us, Washoe County Community Services Department, the Engineering Department, and they said, hey, what can be done? So we started the process of looking at options. We recognized that there was lots of constraints, though. These were older septic systems. We had high perched groundwater in the area, which is problematic. But we also recognized that there was a City of Reno sewer interceptor not too far away. As a matter of fact, right down at the corner of the street. So, of course, that led us to a municipal sewer option to help these residents out and help correct this public health issue. Of course, cost always comes into play. So that was probably what took us the most time, was to go through and identify a cost strategy to help fund this infrastructure. And not just the infrastructure in the Washoe County right-of-way within the road, but also how we would potentially help the residents out by properly abandoning their on-site septic systems and actually converting the piping and allowing those homes to connect to that new interceptor. So we have a little experience with the clean water and drinking water funds down at the state, at NDEP. Fantastic lady down there named Michelle Stamatis, and I just want to give her some really great credit here because she worked very tirelessly to come up with a funding strategy to help pay for this project. And ultimately, that funding strategy resulted in a loan that was capable to be forgiven, a principal forgiveness loan through the Clean Drinking Water Fund, State Revolving Fund, excuse me. Now, of course, we couldn't have done this without working with our community. So Kevin and I and other staff, we went out and had community meetings, talked with the folks, explained what was going on, and we needed their, of course, concurrence to move forward with the project. They were a little concerned. They understood what was in front of them as potentially as in terms of costs. But once we were able to explain what we were doing with the funding options, the only consideration they had at that point was their quarterly bill, right? Because they're on septic systems. And even though we all recognize that as homeowners, and I grew up on a septic system, you have responsibilities associated with cleaning, maintaining, and ultimately replacing those septic systems. But when you're a municipal sewer customer, all that's done by the municipality, but of course you got to pay for that service. So that was a consideration and something for the residents to think about. But ultimately, again, as I said, they recognize the hard work that the health department and that the engineering department were doing for their benefit, and they agreed. So these next pictures, that picture before, the first one just showed the extent of the project, which was the construction of the interceptor down through Panther Drive, and then the laterals that go to each one of the homes to connect. And then these pictures just show some of the construction. So those previous pictures showed the trenching out in the roadway. They showed the depth of the sewer line is about 9 feet. So we had to use trench boxes and those types of things to make sure that the workers are safe out there. That other picture showed a lateral going from the house, ultimately connecting out to the interceptor. This picture on the left shows one of the covers to the septic systems, and then the picture on the right shows the roadway after the sewer line was constructed. They've gotten a new roadway now, and ultimately the road is going to be resurfaced. So again, just a quick summary success. Just as I said, Washoe County Health Department responded to the customer issues, went out and verified that there was indeed a public health issue. They contacted us. We were able to come up with a municipal design, and working with the state, with NDEP, came up with a funding solution. Now, I have to mention that funding solution, that loan forgiveness, it was a bit of a challenge. I mentioned Michelle Stamatis. That program really, it's only $500,000. This was a perfect size project to fit within that. If this had been 20 homes, we were dealing with 10. If this had been 20 homes, had been 30 homes, funding wouldn't have been able to work this way. So this really was a great solution, and a lot of work, again, went together to find this particular program, the Clean Water State Revolving Loan Fund Program, and the principal forgiveness component of that. Again, we met with the community, got the community buy-in. They ultimately agreed to it. They signed waivers that allowed the contractor to go on site and do work on site to help both abandon their septic systems and to connect their homes to the municipal system. And ultimately, even the connection fees that were paid to the city of Reno for the municipal sewer service were paid for through this loan program. So a lot of credit goes to all the agencies working together to come up with this solution, and ultimately it eliminated a public health hazard that existed, and the community is the beneficiary of that. Construction started April 2017 of this year. We just completed it. Total project cost, right under the $500,000 cap, $496,000. So thank you again for giving me a minute just to tell you about the success of this project, and certainly thanks to Kevin for being such a partner on this project. So.
Thank you. Any questions from the board? Councilman Dare?
I just want to say thank you for working so much in the community. I think a lot of times things go in and roll forward, and I'm very big into over-communicating and actually getting community involved, and sometimes it takes longer to do that, and sometimes they don't always have the answer we're looking for, but it's as we walk forward and we'll go back and forth, I think it's a fantastic project when you get to where you did. So as a board member, I appreciate that, and keep doing that. Thank you.
Thank you.
Yeah. Any Mr. District Health Officer?
Yeah, I just also wanted to thank Mr. Smith. That was a great partnership, working together to solve a problem, very solution-oriented. And I think the health district, community services at the county, and the state all working together to try to resolve this. I just wanted to recognize some of the staff from the health district that were involved. We have Mr. Jim English, Mr. Wes Rubio, Mr. Dave Kelly in the back. Maybe wave, guys. We're all involved in the project. A team effort, but once we got this rolling, had the community meeting, Mr. Smith and engineering took it from there to get the construction accomplished, and I want to thank everybody involved. And also, I think, as Dwayne was trying to point out, this is kind of a unique circumstance where we really had a happy ending with it being able to use this funding source, and that's not always going to be the case moving forward, so I don't want to establish that expectation.
Right. Oh, no, that's what we want.
So, thank you very much.
Thank you.
Madam Chair, I just might, and Kevin prompted me to do this, and certainly thanks to my staff, specifically Alan Jones, Senior Project Manager, and Lydia Perry, who manage this project. So thank you.
Thank you.
Thank you.
This is what government is supposed to do, and I'm really proud to see it be done. And I don't know if you're familiar with Panther Valley. I have a small slice of that in my district, and these aren't the most moneyed people in the world that have extra money laying around to do these connections, and that's why that revolving fund exists, so that people do not face a health hazard by not having water that is safe to drink. So thank you. All right, is this an action item? It is. What happened here? So can you, I would entertain a motion to accept the report.
So moved.
Second.
So I have a motion by Novak, a second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 9, Mr. District Health Officer.
Thank you, Madam Chair. Item 9, discussion and assignment of board members as subject matter experts for specific health district program areas. And this is Dr. John Novak to lead this item.
Several months ago, we had talked about having assignments of each of the board members to different divisions with the idea of making a board member a little more knowledgeable in that particular, in case something comes up. We're not going to be subject experts, but we will have a lot more knowledge than the average board member. In keeping with that idea, we wanted each board member to meet quarterly with their division chief along with Mr. Dick at the same time. Like to have the board members coordinate through Mr. Dick because he's got a pretty good schedule in and of itself. We're not looking to solve individual small problems within a division, but what we're looking to do to have a bigger depth of knowledge into what the present needs of the division is, what some of the future plans are and projects that may need board involvement down in the future, plus is there an immediate problem that needs to be solved that takes board action to solve some of the problems to do that. So saying that, the clinical CCHS division will be board member Jung and Hess. The environmental division will be board member Young. Air quality management will be Chris Dyer. Finance is Oscar Delgado. And the epidemiology and emergency preparedness will go to Brown and Novak. So at this point, that's where we want to move, and if board members will start coordinating with Mr. Dick, and we'll get these items going.
I think it's a great idea, and will provide some continuity up here at the board that we can turn to a subject matter expert that is liaisoning, with the department heads as sort of our leader when we make decisions about.
Good idea.
Yeah, because as you are quickly learning, if you're new to the board, Board of Health has a lot of different moving parts and areas of expertise. Some of our most highly educated in the county work for the Board of Health. So this is not an easy fire hose to drink from, let's just say. So does anybody have anything that they want to say? Are you okay with your assignments? And if so, there is no public comment on this issue, so I would entertain a motion to accept Dr. Novak's brilliant idea. I will make that motion.
Cool, yeah. I'm very much.
Do we get a
Madam
second?
Chair, yeah, second.
I have a motion by Jung, a second by Delgado. Councilman?
Yeah, I just wanted to echo Dr. Novak. Appreciate the outreach and the frank discussions and the conversations. Look forward to diving into the finances and be able to, that's what makes the department move, right?
Yes.
And so very much looking forward to diving into those numbers along with Mr. Kevin Dick, of course. So thank you for the
Great.
opportunity.
It's wonderful. Thank you. So we have a motion by Jung, a second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thank you for bringing that to our attention as our now rock star.
Yeah.
He's getting ready to take office too next year at the national level.
Our national meeting starts on Monday afternoon.
Oh, yeah. In Omaha?
No, thank goodness we're not going to Omaha, we're going to Cleveland.
Okay.
Exciting Cleveland,
Yeah.
so. No, our meeting will start there on a national level and hopefully come back with some new ideas out
You
of
always
this one.
do.
I'm trying.
We appreciate you.
Thank you.
All right. Mr. District Health Officer, can you present item 10?
Item 10 is a review, discussion, and possible direction regarding correspondence to be sent on behalf of the District Board of Health identifying concerns and opposition to proposed cuts to EPA and CDC programs and potential impacts to Washoe County. This item is a follow-up from discussion during the last meeting regarding a desire to have a letter drafted to be sent from the District Board of Health to our congressional representatives to alert them to our concerns. Staff and I worked together with Chair Jung to develop a letter for the board to consider to convey these concerns to the representatives, and that's attached as a draft to the to this item in the packet. And I believe the purpose of this is to get any feedback on the letter, if there are any comments or edits or anything like that to the letter. We'd like to get it finalized so that we can move it forward. As everybody is aware, there's been a lot of discussion this week about the health care bill. This one is, the letter is really more oriented toward the federal budget as it's been proposed, and we want to make sure that it gets in so that it can have some impact on decision making.
Does anybody have any edits or changes, or if not, oh, wait a minute, do I have public comment here? No, I don't. If not, I would accept a motion to accept.
So moved.
Second?
I have a motion by Delgado, second by Dare. Any further discussion?
Other than I think it's a very well-drafted letter.
Yes, that's staff, not me, so thank you.
You're welcome. Thank the staff for doing it.
Well, staff, I mean, if you look at the detail and the
yes.
numbers, I mean, that's, Albie, I'm sure, had a lot to do with this letter, and Mr. Kevin Dick, and Leslie Admirand, and Laura Rogers. I think it was a big, giant team lift, and I just looked at it and said, yep, looks good to me.
Ms. Rogers was ready to edit on the fly today.
Oh, look at her. I love her. All right, so did we vote yet? All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thank you, staff.
No, it's going to go to everybody.
Item 11 is staff reports and program updates. 11A is air quality management. Ms. Albee, do you have additions to your written report?
Good afternoon. For the record, Charlene Albee, Director, Air Quality Management Division. Just one update, just in the event that some of the board members have not seen, that the House Appropriations Committee, which Congressman Amodei actually serves on, did approve a marked up of the budget to keep us at level funding for what was enacted in FY17, which actually results in about a 2% cut to the budget, which is something that we can actually tolerate and work under. The trade-off was concessions on a significant number of regulatory programs. So it will still allow us to do our jobs and to protect public health through healthful air. It just may be a little more challenging now with not as many tools in the toolbox, is basically the way we're looking at it. But we're in a lot more comfortable position at this point in time. We're cautiously optimistic. I think the letter that you're getting ready to send out will give support on the Senate side. And from what I've heard from the senators I've talked to at our national meetings, we have a lot of support over there. So I'm hoping that the budget will now go through and we won't be subject to the dramatic changes. But I think that all of the outreach from organizations like ours across the country has really made a difference to our elected officials. So I appreciate the letter going out.
Thank you.
And I'm available for any other
Any questions for Ms. Albee? Councilman Dare?
I look forward to working with you and
Absolutely,
learning.
myself too.
So if you could just teach me everything you know, and we're good.
You've got about 6 minutes.
Yeah. Only decades of experience.
There we go.
How do these fires affect all of this? Obviously, they're going crazy, and they're all over, and we have days that are just off chart. Do we just get to mark those down that it's California fire or it's fire? And then
Well, what we have to do is, for the fires, we have to do exceptional event demonstrations when we exceed the health standards. And that's a program that's in our state implementation plan, so we have to go down that pathway. If you're looking at how potential budget cuts affect us when those fires go on, a lot of the outreach that we do, so our public health announcements, our radio ads, our TV ads, daily AQIs, things like that, our outreach budget would be one of the first ones to be cut. And we think it's very important that we make sure we give the public the information to make good quality health choices for themselves. So if we were to lose the budget that they had proposed, our outreach is what would have hurt the most.
Thank you.
Let me do, excuse me.
My
Follow-up question.
Vice Chairman Novak?
When we're putting the daily, this is where unhealthy is that something through our,
Thank you.
thanks.
You're welcome.
Is that something that has to come out of an outreach budget, or is this just information we provide to the media? And thank them very much for keeping that current to the public.
I think it's a combination of both. We have a lot of partnerships, like with the National Weather Service, that doesn't cost us anything but staff time. A lot of our air quality index is done, Brendan Schneider, that was just recognized, that's his staff time. When you start looking at a 45% budget cut that they were talking about, that would have jeopardized staff. And if you don't have the people around to maintain those stakeholder relationships and update the data and stuff like that, that's where it would come together. So a lot of our, especially during the wintertime, our Know the Code advertisements we have on the radio right now, we've just finished with our No Zone advertisements, which is to anti-idling things. Those do cost us actual fiscal dollars.
Right.
So it's a real combination.
I was just wondering about our daily publishing, like on the weather and stuff like that. Here's your air quality index for today. That does not come out of our budget, does it? Other than
Only in
staff time to
staff.
put it together?
Only in staff time.
Okay, thank you.
Yeah.
Any other questions? Thanks, Ms. Albee.
All right.
Item 11B, I do have somebody signed in for public comment, but unfortunately, or 11C, sorry, never mind. 11B, I'll talk to you about 11C in a minute. 11B, Community and Clinical Health Services, Mr. Cutts, do you have anything to add? Yes, you do.
Again, Steve Cutts, CCHS Division Director. Thank you for the opportunity to comment here. I just wanted to say, if anybody has had the opportunity to go down toward the health district, the hallway along Wick is currently torn up. I wanted to send out some kudos and compliments despite a bit of disruption, and it's taking a little longer than we had initially anticipated, but wanted to thank Aaron Dixon and Anna Heenan for working primarily with Community Services Department, in particular Steve Gross and Scott Martin. The project ended up being a bit more disruptive and messier than any of us anticipated. They put together a cleaning team to mitigate the impact to our clinical services incredibly quickly. We're very appreciative of that. And I wanted to also get on the record and thank my incredibly flexible staff and my management team. Particularly hard hit was our WIC program, our immunization program, our central clinic services. Wanted to thank out of Administrative Health Services, Anna, and as well as Brentley Hancock, our department systems specialists. They helped what we believe is save some of our computers and immunizations that we didn't realize would be quite so impacted by the dust. So we're very appreciative for the county, both within the district and outside of the district, pulling together and helping us out. And we look forward to when the hall is completed.
Thank you for the update.
And with that, I'd be happy to answer any questions you may have.
Thanks. Look forward to working with you.
Thanks.
Item 11C, Environmental Health Services. Kevin Dick is our acting director. Ms. Brandhorst, you signed in for public comment, but this is not an action item, so we don't take public comment, okay? I will call you up on item 13. Okay? Mr. Kevin Dick?
I only wanted to provide an update that you have probably seen, which is that we did get back earlier this week 7 mosquito pools that were positive for West Nile virus. So we're continuing. This is 8 pools total that we've collected now. So we're continuing to see West Nile virus activity. So our staff responded and have been fogging in these areas. We did apply larvicide with area-wide helicopter application July 12th and 13th. And we're on track for our next helicopter application in August. That's scheduled to coincide with the effectiveness of the larvicide that we've applied so that we can sustain our abatement activity. That's the only update that I had for environmental health.
Any questions for environmental health? All right. Item 11D, epidemiology and public health preparedness. Dr. Todd?
Good afternoon again. Randall Todd for the record, Director of Epidemiology and Public Health Preparedness. I had just a couple of things that I wanted to update you on from when my written report was submitted. First, on the unusual occurrence of illness, we were talking about a couple of new cases of carbapenem-resistant infections. One of them was a New Delhi metallo-beta-lactamase, and you may recall back a year or so ago, we had one of those. It was a New Delhi metallo-beta-lactamase. There are other carbapenem-resistant mechanisms besides the New Delhi one. New Delhi is a little bit uncommon in this country. But this more recent case, our first case was a Klebsiella pneumonia. This case is an E. coli, but both share this same New Delhi resistance factor, New Delhi metallo-beta-lactamase resistance factor. Both of these cases had traveled to India, and we are currently in the process of evaluating some of the household and other contacts of this case. So we may have more to update you on later as we get those results back. I think you may recall that we had published an MMWR article, Morbidity and Mortality Weekly Report article, about the first case. And MMWR now puts an altmetric score on the article, which is based on how much are people blogging about it and tweeting about it and Facebooking about it and so forth. Right now, that article for 2017, it was published in January, I believe has the highest altmetric score of any article published thus far in the MMWR. They consider a score of 9 or higher to be significant. Our score, I just looked it up now, is 2,072.
Whoa.
So it's been getting a lot of play for a little one-page article in the MMWR. So that is coming along. The other carbapenem-resistant case that we have is not a New Delhi metallo-beta-lactamase one, but it is a Klebsiella pneumonia. So these get kind of confusing. The second thing that I wanted to update you on is coccidioidomycosis. In my written report, it mentioned that we've had 7 cases so far this year. I now have to report that that's up to 8. And my report indicated that we had typically been seeing 2 or 3 cases a year. And so we've seen 8 so far this year. I believe we saw 8 last year, and I believe 9 the year before that. So it's definitely increasing. Our suspicion has been that the endemic area for this has perhaps expanded. If you look at the map that CDC publishes, we are just north of the area where it's thought that this lives in the environment. And so most of the cases that we used to have when we had only 2 or 3 a year were people with travel histories. Arizona is the national capital for coccidioidomycosis.
What is it?
What is it? It's a fungal infection. So these organisms live in the soil. If the soil is disturbed and creates dust, you tend to breathe them in, and it can create this type of a problem.
So it's a respiratory illness.
It can be. It can also be disseminated. It can manifest in a number of different ways. So we, including it can be completely asymptomatic.
Yeah.
Ask him if there's a common name for that.
What's the common name for it? Pertussis? No.
No, the common name for this is valley fever.
Oh, valley fever. Okay.
That's a
yes.
lot easier to say than coccidioidomycosis. Yes. Or we call it COXY for short sometimes. In any event, we had a conference, a workshop just earlier this week, and it was well attended. We had about 30 or so people who came to learn about this. We had some guests from the Centers for Disease Control, including Orion McCotter, who is fairly recently with the CDC, but for about 9 years before that, he was with the Arizona State Health Department. So he is a very knowledgeable individual about valley fever, and he did an excellent job. We also had a Dr. Anna Litvinseva, who is the lab person at the CDC on this issue. And then from our local area, we had Dr. Annetta Rink with the Nevada Department of Agriculture. So the three of them presented. CDC brought one other person whose name escapes me at the moment, but she was a lab person. So they spent some time working with our state laboratory. They then took several of our staff out into the field, and they went digging for cocci in the environment. I believe they've submitted 15 samples to the state lab and 15 to the CDC. So hopefully we'll be able to assess our own cocci in the near future. And one of the things, well, we hope to be able to find some proof that we do have it in our local environment. And there are some differences that you can tell by looking at some of the genetic markers. And so we hope that they will be adding Nevada to that genetic marker map so that when we get a case, we can more easily tell if it was locally acquired or acquired through some travel-related exposure. But I did find it interesting. We talked about West Nile just a few moments ago. There are quite a few more cases of this than there are West Nile, but you almost never hear about this one.
Right. Well, I meant to come to your workshop on Tuesday, but I had an 8 a.m. investment committee meeting that my chairman let go for a very long time. And so then by the time I could have came down here, I would have had like 15 minutes, and then I had to start the meeting that my chairman dictates that I be at. So I wish I could have been there. Good job. And
Okay, well, we missed you.
I missed you too, and I just want to say again, congratulations for your paper, your white paper, and getting all those hits on that. And I wonder if this cocci migration going north has anything to do with climate change. And if you could look into that.
Wondered the same thing. I don't think we really know.
I mean, I know the Chinese created that as a hoax and stuff, but looks like it's working out.
There is a small patch of cases up in Washington State now, which is way north of where it has traditionally been found. And they did do some field work and found it in the soil there. So we know that some of those cases were locally acquired. So it's not far-fetched that we might find it here. The problem is when you go looking for this in the soil, it's very patchy. So, if you dug 6 inches further away, you might have found it, but where you happen to dig, you didn't find it. So it'll be interesting to see if we get it or not.
Very interesting. Any other questions? Vice Chairman Novak?
Not a question. I just want to tell you I was very privileged in going. It was an extremely well put on meeting. The subject experts from the CDC were right on spot. They knew it. And the questions from the audience, which there was a lot of very experienced people in the audience, were extremely good and very timely. So I really want to commend you on putting on a terrific meeting.
Thank you. This was mostly Dr. Lei Chin's work, but I'll relay it.
Please let her know. Anyone else? All right, thank you. You've been busy. Finally, we have the District Health Officer's Office of the District Health Officer report.
Thank you, Madam Chair. Several things I wanted to highlight. Sent 3 different letters to our congressional delegation. One on the Senate Better Care Reconciliation Act, another on the proposed elimination of federal Title X family planning program funding, and also a letter on the proposed elimination of funding for Nevada for the hospital preparedness and planning program. We also provided copies of those letters to the county managers, legislative representatives Al Rogers and Jamie Rodriguez for transmittal to the county's legislative lobbyists in D.C. I wanted to spend a little bit of time to brief you on my attendance at the NACCHO annual conference and some of the things that I learned there. As an attachment to my monthly report, I provided a document, the NACCHO's Public Health 3.0 issue briefing paper, and I was very encouraged at the conference to feel that we were on the right track with what we're doing and that we are kind of on the leading edge with what health districts are doing with Public Health 3.0, working on a community health strategy, using multi-sectoral coalitions to work together to implement those strategies, looking at social determinants of health and health equity in the community. And I guess, one of the things that we're struggling with is also contained in this paper, and that's the difficulties in obtaining sustainable and flexible funding to support these types of initiatives. And then lastly, accreditation is also identified as an important thing for health districts to be working on moving forward for Public Health 3.0. So I came back feeling we're not alone with what we're doing. There are other health districts taking similar approaches and having success out of it. So I was encouraged by that. I wanted to share with you a presentation that I had the opportunity to attend. This was, I provided you actually with handouts of some of the charts because they may be difficult to see on the slides. But if we go to the next slide.
Technical difficulty, 1 moment, please. The Word document's frozen and I have to close one and then I'll be right
That's
with
okay, we can wait.
you. Sorry.
Why don't you talk about something else?
Here we go.
Oh, okay,
Got it.
okay.
So this was a population health presentation for a plenary session by Dr. Sandro Galea, and he was kind enough to share his slide deck with me. If you'd advance, next slide. And I'm going to run through these pretty quick, but I just felt like this was a good picture of where we're at with public health and health care. This is a chart of U.S. life expectancy at birth from 1900 to 2014, so you can see a significant increase in both men and women, but not so much, but our progress is not what it should be. If you look at the spending that we've got in the United States compared to 17 peer countries, our age standardized death rates per 100,000 people, we're on the high end of that. And then if you look at our life expectancy versus the G7 nations, which is the next slide, we're again not doing as well as the G7 nations. This is a slide that shows U.S. female life expectancy at birth relative to 21 other high-income countries, and you can see that the band for life expectancy is going up for all of these other countries much more quickly than in the U.S. This slide shows you the discrepancy that we have between different areas with people's life expectancy. So you've got an African-American male in Arkansas has a life expectancy of 68 years, and yet in the same country, in Minnesota, a white female's got a life expectancy of 83 years.
You have to be a very hard woman to make it through a winter in Minnesota,
That's
though,
right.
let's be honest.
All right. So are we not spending enough money on this? This is the average spending on health per capita, and you can see that the U.S. is far exceeding other nations in what these are the other Organization for Economic Cooperation and Development nations. We're far exceeding that. Next slide. This is a slide I actually pulled in from another presentation that I saw, which shows that our total spending, though, when you look at both health care and social services together, is not exceeding what other countries are expending. And what's interesting, if you look at the U.S. graph here, or bar, the amount that we spend on health care is much more than what other nations spend, and yet the amount that we spend on social services is much less. So things are kind of out of whack with where they should be. And then this slide shows you life expectancy versus health expenditures over time. And while we've continued to expend more and more money than other nations, we have not been able to achieve what they have with increases in life expectancy. So where is all that money going for health care? If this is the pie of all the money that's spent, and a small piece goes for prevention from keeping us from getting sick, and most of the money goes for treatment for us once we get sick. A top-level example of how we're misspending our money, here's obesity trends in the U.S., and I think everybody's familiar with these maps. If we go to the next one, we've got increasing obesity from 1990 to 2000 to the next slide in 2010. So obesity is increasing. we're spending our money in genetics and how can we expand our healthcare capabilities with genetics. That money is going up. Yet the calories that are in our food have increased dramatically from what they were 20 years ago. And our funding for non-genetic population health has decreased substantially over the years. So what else should we be doing? Building a world that generates health. And here are some examples of that. A city of 1 million residents, a 40% expansion of transit developments has an annual health benefit of $216 million. After rehabilitating housing, 62% of adults have excellent health versus 33% before. And worksite obesity prevention programs that reduce weight loss by 5% result in $90 per person savings, and costs of obesity are about $73 billion among full-time employees nationwide. We know that early education has significant benefits, cost ratio of 5 to 1 with a reduction in crime rate, child maltreatment, and teen pregnancy. And each time the earned income tax credit increases by 10%, infant mortality drops by 23.2% per 100,000. And we can do these things. This is a chart that shows you the number of deaths per million vehicle miles traveled from 1925 to today, or 2000, I guess is what it looks like. And while vehicle miles traveled have increased significantly, the upward curve, the deaths have decreased significantly even while the miles are going up. There's a sense amongst some in the population that, yeah, but I can buy myself a longer life of better health. But can they really? Because with public health, we know that we need the public to be healthy. Up to 50,000 people have died from flu since 2010. This is a largely vaccine-preventable disease. People are getting flu because other people are not getting vaccinated. 10% of children are killed by motor vehicles. 10% of children killed by motor vehicles were pedestrians killed by alcohol-impaired drivers. And so if we can't protect ourselves from that unless we act on that problem. Your risk of becoming obese increases by 57% if you have a friend who becomes obese. So if we help everybody not be obese, it's going to be easier for all of us, right? So the bottom line is that what we're doing imposes a health glass ceiling on all of us, and we need to be doing things differently. And so I thought that was a great presentation and wanted to share that with you. I also wanted to share with you what's called High Five, and this is Health Impact in 5 Years that's been developed by CDC. Next slide. And basically, it produces 14 interventions that earn the highest evidence ratings, show positive health impact within 5 years, and report cost effectiveness and savings over the lifetime of the population or earlier. So next slide. So the health impact in 5 years is being used by an initiative called the Big Cities Program, where big cities are working around these issues and developing policies and scoring and rating themselves as to how they're doing. City of Las Vegas happens to be one of the participants, or Clark County, I guess, one of the participants in this program. And then the next slide. So these are the different evidence-based community-wide initiatives that they're including. And we're involved in some of these activities, school-based programs to increase physical activity. We've got some school-based violence prevention in our CHIP. We participate with safe routes to schools. Motorcycle injury prevention, we don't have a program there, but tobacco control interventions, we do have a program. The measure that they're using in big cities for this is Tobacco 21. And I was at one session where there was a representative from the Kansas City Chamber of Commerce, and they're involved in a multi-sectoral coalition in Kansas City called Healthy KC. The chamber was actually the lead entity in an initiative to work at the local level to enact Tobacco 21 ordinances. So that's no tobacco purchases unless you're 21. And we're actually currently looking into, is this something that could be done at the local level in Nevada? Does the law provide for that? Access to clean syringes. So the Northern Nevada Hopes has a program for that. Pricing strategies for alcohol products, multi-component worksite obesity prevention. early childhood education, we've got some, community service agency initiatives and others. Clean diesel bus fleets is something air quality's been involved with. Public transportation system introduction or expansion, that's something that we've been active with RTC to try to promote that. And then, of course, we made a try at water fluoridation this past year. So I think we're on some of the right paths with things that we're seeing that other communities are working on nationally, and that can have impacts for our community. So that's my summary of the NACCHO conference. I had a couple of other things that I wanted to touch on. One is water system regulation and plan reviews. And we are continuing working to try to address concerns about the health district and our role in these plan reviews. I've had several meetings. We've got another meeting coming up with Tumwa and Community Services Division on Monday to talk about this process. But I wanted to let the board know that right now the health district's review time for plans that are coming in is 15 calendar days. And so we don't have a long review period for these plans. The plans are required to meet the regulations that are in the Nevada Administrative Code. And I don't have the authority, the health district doesn't, the board doesn't, to waive those regulations. And so to approve the plans, they need to meet the Nevada Administrative Code requirements. And so there's only so much that we can do to facilitate getting plans approved. And I think it's the process of helping people understand what needs to be submitted in a way that can be approved. And when we approve a lot of plans, right through, because they're submitted and they're proper. But we cannot change NAC, and I will continue to fulfill my responsibilities that for us to approve plans, they need to comply with NAC. So in accordance with state law.
Can I make a comment to that?
Yeah.
Or do you want me to wait till the
Councilman
end? Okay. Can you, well, this is obviously a conversation we're all having as well, so it's not with that, but since you brought it up in your thing. So is 15 days, is that what it's always been? Is that?
I think it's always been fairly close to that. And let me maybe explain the process. What happens is for say a set of or a development that's occurring in Tumwa's distribution system area, the plans are submitted to Tumwa, and Tumwa has to review those plans and then submit them on to the health district. And I believe that the Tumwa review time frame is about 6 weeks right now. And so the plans go through Tumwa, and then the plans come to the health district after they've gone through that process, and then we begin our review on the plans. And and then when we're done with our review, the submittal is from Tumwa, and it goes back through Tumwa because they have to take the water system over. It goes back through them to the developer. One of the things that came up and that we're exploring is if we can do some concurrent review, particularly if we've got revisions that we're requiring on plans to have Tumwa and the health district both look at them for that second review at the same time.
No, I like that idea, actually. I mean, I don't know how it all worked out, because obviously, and I'm sure I'm not the only jurisdiction getting phone calls, something happened in this last short amount of time where something's changed. And so we weren't getting these calls. Now, part of it's growth. Part of it's just we're growing. And so you can't blame anybody or anything for that, but it seems like there's something else there. And so one of the things that I know that our city managers probably has a voicemail to talk to you as well. We have developers calling all of the different city councilmen. Something has shifted here, it seems. Now, with that said, that's where you get to do your job, and I'm not here to tell you you do a good job, and I'm not at all coming against that. But I do know I'm being asked when I came here today, and I know everyone else has been asked from their own jurisdictions to say what's going on here. We can't break the law. No one's asking us to do that. But we have to come up with an answer that actually does not halt this growth and makes it to where it feels like everything's hinging at the health thing. Now, that's what's being said. That doesn't mean it's true. We know that. We know a lot of people say, a whole lot of things, and they like to blame a whole lot of people. But I'd like to know, in the long run, how can we make it to where we're not the hinge pin that seems to be the block that's blocking it? That would be kind of my approach, and I do like the idea of if there's a possibility of if something's taking us a little longer for some reason, how can we get these a little quicker so we aren't that problem?
Yeah, and if I could respond to Councilman Dare, I think one of the contributing factors to this is that the health district has not in the past reviewed plans in full conformity with the NAC. And so the problem that we have is that while the regulation hasn't changed, the awareness of what is required to be done has changed, or just us doing it. And I can tell you, a few years ago, soon after I came on as the health officer, we were down our engineer position was vacant, and the state was reviewing plans for us, and we had a pretty, I guess, tense and severe meeting with them after their experience with that, as to what we were doing with our plan review, with what was coming in to them. And we've been working to correct that situation and to get things fixed with our plan review. We in the past were in a position where we had plans that were coming in that didn't have sewer identified on them, and yet part of the NAC is separation distances between water and sewer. So things have changed, but it's because that's what NAC requires for these plan submittals.
I had one more question, if that's okay. But I'm trying to remember it. I'm getting old. I know, my glasses and all that good stuff. No, I think that's good for now. We can talk more later, but thank you. I appreciate that.
And I can add one more thing, is that Don Tatro of the Builders Association and I went down to Carson City and met with Jennifer Carr, who's the Deputy Administrator for NDP, and discussed with her concerns regarding NAC that were creating difficulties in ability to approve plans. And she did leave the door open to consider a limited list of areas that we could propose to work together to see if we could make some changes to the NAC to correct those. And I've got a short list over to Mr. Tatro for him to consider with some of his members, and we're also discussing this with Tumwa to see if we can agree on what's a good list that we can all work together around to see if we can try to get some changes. That's a longer term strategy. It's not like NAC gets changed overnight. There's a pretty extensive process, but 12-month to 18-month type process to really make things better for the future.
Thank you.
Any other questions? Councilman Delgado?
Yeah, Madam Chair, thank you. I don't want to belabor the conversation. I think it's really important. And Councilman, I believe you sit on both boards, Tumwa and our health boards. I think you'd be a perfect conduit to bridge some of those conversations. I think there still is some disconnect in terms of who said, she said, he said kind of opportunity. So it'd be great to bring some clarity and be willing to work with you in terms of how we could all solidify, everyone's trying to move projects forward. No one's trying to hold anything up. I think there's just some loss of communication. And in all honesty, I think there's some opportunity for some new voices to be at the table. So happy to work with you, and I think you'd be really a good point person to help with that conversation.
I actually do have the one.
Yes, go ahead, Councilman.
This is not a staff issue, though, right? And I say that not as a human being. I say that as enough staff. I'm sure the staff's fine, but I'm talking about because that's one of the things that have come up is because we've had this problem in Sparks where we don't have enough staff, so we're trying to figure this out. Are we having a staffing issue? That was one of the questions, and I thought if there was a way to answer that.
Yeah, I guess when I'm looking at a 15-day turnaround, to me that's not a matter of trying to get more staff on board. So I will tell you, our staff are working hard with what we've seen with the growth, but I don't think that's the problem that's causing this.
Thank you.
All right, any other questions?
I've got one other thing that I
okay,
just
go
wanted to
ahead.
follow up from the last meeting, and that was a question about SB 429. So I put that on page 3 of my report. That's the Urban Agriculture and Community Gardens bill, and there was some question about what this allows for cities and counties to do. And it provides that an urban agricultural zone can be created by ordinance, and it also provides an urban agricultural element may be included in a master plan. So it doesn't require it be in the master plan, but it says that it may be in the master plan. If it is, the element must include a plan to inventory any vacant lands owned by the city or county and blighted land in the city or county, determine whether such lands are suitable for urban farming or gardening. And then it provides that the governing body of a city or a county may by ordinance authorize the use of vacant or blighted land for community gardening, and the ordinance may establish fees for the use of the land, provide requirements for liability insurance, and provide requirements for a deposit to use the land. So basically, the legislation facilitates the ability of cities or counties to establish community gardens on city or county lands.
Great.
Great, that's all I had.
That's good news. Any other questions for our district health officer? Nope. That leads us to board comment. Does anybody have any announcements or issues for future agendas? Dr. Novak, my vice chairman.
Thank you. Hopefully we're on. Got under some of the stuff that has come out with NACHO in your meeting, the HHS 3.0 public health initiative they've started, and also the latest issue of the NALBO that we should all have, are all pushing for accreditation. And I'd like to make sure that we continue on that line. We have got a good start. Sarah's been working hard on it this last year, and I'd like to keep that up. And if possible, I'd like maybe a status report, maybe the next meeting, because I know that's some of the things that's going to be talked at the NALBO meeting next week. So just kind of get an update.
Great. Okay. Anybody else have any? Yes, Councilman Dare?
I'm not sure if everyone else is going to this, but I got invited to the Community Health Needs Assessment September 8th. I am planning on going, and if it's put on by us and Renown. Do you know what that? I think your signature's on that, I believe.
Yes.
Is that something? Is there something to prepare for that, or?
So
is that
that's,
something
so
that'd be
this is
good for us
board
to be-
comment. This is not listed as an action
Oh,
item.
sorry,
Or
okay.
so he's asked the question, so can you help him afterwards?
I will follow up.
Instead of now?
I will
Thank
follow
you.
up with the communication of the
Did I do
entire
right,
board.
Leslie? Thank you.
Thank you. I'm a
She's
rebel.
smiling.
That's all.
Thank you. Anybody else? Okay. Final public comment. And I do have somebody signed in, Miss Kathy Brandhorst.
My name is Kathy Brandhorst, and I'm also the United States President. I guess I will start with the program updates. Food and land development, safe drinking water, schools, waste management. Food. I'm still getting lots of complaints that you're not feeding children at the St. Vincent's dining room because they have no parents. And they don't even get a box of food because they need a parent. And they don't get nothing at all, so they are very hungry. And people try to help feed, but they don't even show up. Safe drinking water, I've seen kids drink out of the river because they don't have no water to drink at all. There's no store water. for them to drink, so they have no choice but to drink out of the river. The schools, we're still having missing children even on the school buses. The school buses are usually 15, maybe 20 children, but lately there's only 2, 3 children. Why? Because the people that are not human still need their body parts. So the children are found dead. The waste management, I wanted to let you know that there has been lots of chopped heads in my territory, my area where I live. But those chopped heads are removed by the waste management, and they are tired of being victims because they find the chopped heads. You know, these people are workers, and that's all they get is a payroll check. They don't get nothing else. But they do have to pick up the body parts in the bags. They have to pick up the chopped heads in the bags. And they know what's already in the bags because they have to open up the bags to see what's in it. The federal budget.
Thank you very much, Ms. Brandhorst.
Bank robberies.
All right, seeing no other public comment, we are now adjourned.
Very good job. Good job.